Next, we are visiting with Karen Kaplan, the marketing coordinator for TriCity Family Services. We very much appreciate your being here with us, Karen. Thank you.
Thank you for having me.
Can you tell us about TriCity Family Services, what it is and what you offer?
Okay. TriCity Family Services is Kane County's leading provider of counseling and other mental health services to residents of all age levels and all income levels.
And so what's unique about that?
Well, it's the variety of programs that we offer. We do counseling for individuals, for couples, for families, for seniors. We also offer workshops and support groups for different age groups and on different issues like anger management or anxiety or single mom support. We also have a very innovative family-based treatment for eating disorders, which is one of only 3 of that type of program in the state of Illinois that looks at the family as part of the cure for the problem rather than part of the problem itself. We also offer employee assistance programs for people to achieve their peak performance in the workplace and at home.
So with this wide range of services, who is eligible? Are there eligibility criteria for getting services from you?
Everyone is eligible. That's the great thing about our agency. A lot of people do think that as a nonprofit we only serve low income or certain populations, but really we're there for everyone in the community. Especially if they're facing issues in their lives that they need support for, whether it's a divorce or the death of a loved one, or school anxiety, or depression. These are things that people all pretty much experience at some point and may just need a little assistance to get through to keep as mentally healthy as they are physically healthy.
Now, are there services that you don't offer? Things that are outside of the boundaries of what you offer?
We do not serve the clinically mentally ill, which means people who have ongoing issues that require either inpatient treatment or ongoing working with them. Our biggest goal is actually to have our clients work through their issues and then go back to their daily life and not need us anymore.
Can you tell us about perhaps somebody or a case that has come through the TriCity Family Services that sort of illustrates the kind of services you offer and how you help people?
There's such a variety. There'll be the child who is having school anxiety. Maybe they have Asperger's or ADHD and they're having difficulty at school, and our therapists can help them work through those issues and make them more comfortable going back into the learning environment. We've had adults who are suffering reoccurring nightmares who need some therapy to help stop those. We have the eating disorder clients who, they'll go 3 or 4 weeks without binging or purging, and that's a huge success.
Absolutely.
We have clients who've gone through our Wilderness Challenge program, which is a very unique program where they take the kids out into the Boundary Waters area in Minnesota. They just got back actually, and teach them leadership skills and empowerment skills. And we had a client come back. He'd gone through the program. He had joined the Navy, and he was going to be stationed on one of the big Navy vessels. And he said thanks for really helping him become who he is today.
How are your services funded?
About 35% come from client fees and insurance reimbursements and Medicaid reimbursements. About 35% come from private donations from individuals, from corporations, from our fundraising events. About 20% come from public sources like United Way and the 708 boards, and then the rest come from just a variety of smaller pots.
Now, with the range of services you provide, there must be a range of different kinds of staff members and counselors you have. Can you tell us a little bit about your staff and what they do and who they are?
We have 25 licensed therapists, and there are different certifications that they have. There's licensed clinical professional counselors, we have licensed social workers. There are all sorts of letters after their names. We also have 2 psychiatrists on staff that can prescribe medications if necessary. And 2 interns, sometimes up to 4, that are working through their master's programs, and then our administrative staff that kind of keep the agency running behind the scenes.
So you've got a lot of different resources that you can bring together to help people through their various issues and problems. Are there opportunities for people to volunteer with your organization?
Absolutely. That 35% of our money that comes from donations, a lot of that is raised through our fundraising events. And we always need lots of help planning those and running them on the day of the event. The ones that are coming up, we have a Tee It Up golf outing that's going to be September 28th. Well, we had done golf outings in the past, but we're resurrecting it. And we have our Snowflake Shuffle, which is the 5K run in December.
Sounds cold.
Yeah, it takes a certain kind of person to want to go run outside in December.
Yes.
And our gala event, which is in April, which they're already starting to plan, which is our really major fundraiser that takes a lot of work.
Great. And so how can viewers learn more about TriCity Family Services?
Our website is tricityfamilyservices.org. There's a lot of information on there, both for potential clients and for potential supporters. The top of the web page is geared towards clients. It talks about our therapists and our services and what to expect when you contact us. And at the bottom of the page is all about how you can get involved with the agency or support us in other ways.
Now, how are the people that you're serving, do they contribute evenly to the costs of the services? Is everybody on the same fee schedule? Do you have a sliding fee schedule?
No, we, as a community nonprofit, we do accept all major insurance plans, or most major insurance plans. And we do have a sliding fee scale depending on the size of your family and your income level. We don't deny services based on an inability to pay. And we also provide services in both English and Spanish.
Then you said there would be something that I didn't know, and that's the one thing that I didn't know. So that's a wonderful resource that if somebody is not as conversant in English as they are in Spanish, they can get services that are there that are going to be perhaps especially useful to them because there's going to be better communication.
Absolutely.
Well, that's wonderful. So thank you for telling me something that I didn't know about TriCity Family Services. And thank you for telling us about this great local resource for viewers or for the people that our viewers might know.